Thank you, everyone. I hope you enjoyed the break. And I know we've gotten a lot of feedback that we just never have enough time for networking and conversation starting. So I'm glad that you all had the opportunity to do that. I'm going to be very quick here, but I'm very excited to introduce the next session for us today. We just had a very interesting conversation around AI deployment, friction, partnerships. And now I think we want to really think about markets, right? And how all of the work that we're doing eventually transcends into the markets. And it is very important that we sort of be able to understand our lessons learned, our failures, but also our successes. So with that, I am very delighted to introduce Jessie Katz, who is the founder and CEO of the Partnerships Lab. And she is going to help us facilitate a wonderful conversation around moving from market shaping to market building. Jessie, over to you.
Thank you so much. Good morning, good afternoon. Thank you so much for joining us. You know, today and in these day and age, time is our most precious currency. So we really appreciate you deciding to show up today and be here and spend your time with us. And thank you to the Bay Area Global Health Alliance for convening this really important dialogue from market shaping to this new term that we're trying to introduce, market building, and what the next generation of health markets should actually look like. Now, for those of you who are a little bit newer to the market shaping space, let me give you a little bit of a definition and context, and then I'll invite my panelists who know a lot more about this subject than I to the stage, and we'll have a really interesting dialogue. So in terms of the definition of market shaping, we use this term to describe the use of financial, policy, regulatory tools that can solve for market uncertainties, address market failures in a way that allows for increased access to medicines, diagnostics, vaccines, health innovations, with a particular focus in low and middle income countries. And over the past 2 decades, really, market shaping has had a tremendous impact through tools like pooled procurement, demand generation, voluntary licensing, advanced market commitments. I can go on and on. There's many different shaping strategies that can be customized to the specific situation and need of the community, of the product, so on and so forth. And this is really done to reduce uncertainty, lower prices, and increase uptake of an innovation. And there has been tremendous success and impact through market shaping to date. In HIV alone, for example, HIV is the case study we typically point to most in terms of scale and impact of market shaping success. So, for example, in HIV, in the early 2000s, treatment for HIV per person per year was $10,000. Today, it's under 40. So that shows the scale and the scope of these types of strategies. But as we know, the environment is shifting. So it's really important that we think about different types of market shaping strategies and solutions that we can bring to bear to meet the market where we are. So as you all know, COVID really exposed major vulnerabilities and inequities in the system. So we saw vaccine inequity, manufacturing being concentrated amongst very few manufacturers, fragile supply chains, and also dependence on externally financed systems. And now we have new challenges. We have constrained financing environment, reductions in traditional ODA, and this is really creating new urgency that we haven't seen before. So really thinking about an emphasis on sustainability, resilience, country ownership, and long-term market viability. But at the same time, the market itself is shifting, right? So historically, market shaping was largely a conversation between governments, manufacturers, and in some instances, multilaterals and development actors. But it was often focused on reducing price for vertically funded products. And these products were typically purchased through centralized procurement systems. But as we look ahead to the future, we have a much more complex and dynamic environment that we have to operate in. So we're seeing an increased burden of NCDs, a growing middle income population, increased private sector participation, direct to consumer health models. We have things like local manufacturing being prioritized. And these non-traditional health actors need to be a part of the solution. And they're beginning to shape how health products and services are financed, distributed, demanded, and consumed. And this all means that we're going to need new incentives to align on, new mechanisms for partnership and collaboration, and new access, financing, and market shaping strategies in order to meet the moment where we are. And many of us last week, sorry, my glasses keep falling down, were at the World Health Assembly. And this point was really reinforced, that there's growing recognition that the future of global health will depend less on shaping markets for individual products and more on building integrated, resilient, and sustainable systems. So today, that is our challenge, to explore what this next generation of market shaping should look like based on where we are today, and what new models, partnerships, financing approaches we can implement in order to move forward and meet the moment where we are. So my challenge to you all and to the panelists who will be joining us is to really think about this. How do we push this conversation forward and not revert to historical market shaping approaches? How do we bring new ideas, provocative thoughts to the table and really say openly what we might not have said enough before? So without further ado, Joanna, would you like to join me up here? And we have our panelists as well. Over here, I think is perfect. And I'm going to turn this a little bit so I can see the screen. Can you see me if I sit like this? Okay, amazing. All right, so I'm very excited to introduce the panelists we have here today with us. Joanna, I'll start with you and then we'll go to those virtually. Please just introduce your name, organization, and give us a few words on the role that your organization plays in the market shaping dynamic.
Hi, everyone. Oh, no. Hi, everyone. Very happy to be here today, and thank you for the invitation. I'm Joanna Sickler. I'm the Vice President of Health Policy and External Affairs for Roche Diagnostics. My role covers all markets, all types of markets around the world. But I think related to global health, we are the primary supplier of HIV viral load testing throughout Africa and have built most of the diagnostics infrastructure around that that exists today. So going through these transitions that are happening, they're very significant for us in terms of thinking about how we will be working going forward to ensure delivery of the diagnostics that are in place. But I think more importantly, opportunities to expand access to diagnostics.
Excellent. Thank you, Joanna. Let's go to our virtual participants. Jay, we'll start with you.
Hi, everyone. I hope everyone can hear me well.
Yes.
Thanks. Thanks again for inviting me, and sorry I couldn't be there in person. So I'm Jay. I lead the Independent Access to Medicine Foundation. We've been for about 20 years using research that we uniquely develop to create evidence to influence the actions by some of the largest pharmaceutical companies on access to care in low and middle income countries. And our work is mainly in terms of market shaping. We study different market shaping efforts and its effect on access. We look at the responses that the industry, or sort of the, how does industry actually respond to the different market shaping mechanisms that have been in place and what's happening in the future. And when we identify practices that are working and where we see the patient reach and the scale numbers coming forward, we try to promote those practices so that we can sort of promote more scale up of some of these practices. Personally, a lot of organizations also come to us for data and advice on market shaping activities. So that's basically how we work in the market shaping sphere.
Thank you so much, Jay. Yasmin.
Good morning, or I guess good afternoon. Again, thank you for inviting me. Can you all hear me?
We can.
Okay. My name is Yasmin Chandani, and I lead the inSupply Health team. inSupply Health is an East African health advisory firm. We focus on, we're relatively young, especially compared to the Access to Medicine Foundation and some of the other panelists, but we started out sort of working on resilient supply chains. We work very closely with governments in Kenya and Tanzania, and now Ethiopia and Uganda, and are relatively new to the market shaping space. But what we come from the perspective of sort of helping governments to implement some of their ambitions around building broader access to care in some of these markets across public and private sector. And I think what we try and do is bring the perspective of the client, the human-centered aspect. So when you are trying to expand access, how do you, beyond a product or even, integrated resilient systems are really the gold standard, but even within those, access and equity can be lost. So how do you bring in the human-centered perspective and make sure that as you design and try and shape and build broader access, that those elements are not lost? So that's a little bit about what we do.
Excellent. Thank you, Yasmin. And we're excited for you to provide that perspective today. Marianne, over to you.
Thank you so much, Jessie. I'm sorry I couldn't be there with everyone. I'm Marianne Etiebet. I'm CEO of Vital Strategies. We are a global public health organization that works with governments and civil society in over 50 countries across the globe, as you can see behind me, to help build, what I've started to call next generation public health systems. We come to market shaping from at least two different directions. One, we focus on unmet need, unmet health needs. And in today's world, a lot of that is non-communicable diseases. So, the chronic diseases like diabetes, hypertension, cancer. We know so much of those diseases are driven by factors outside of the health system. They're driven by the conditions in which we live and work and play. So whether it's air pollution, whether it is tobacco exposure, whether it is sugary beverages. And so we work with governments to change the environment that people are living in through long-term policy change. So that's, one way in which we want to create, or we work to create, markets that support health in people's everyday life. In the second instance, and I think, Jessie, you spoke to it a little bit around in the global health environment that's existing right now, really we are seeing and we are wanting to see an even faster shift to national governments in terms of strengthening their ability, capability, and institutions to better shape markets. And so the work we do with national governments supports the data infrastructure in which they are able to understand the health needs of their citizens. But also in today's world, and I just can't wait to get into the conversation, where, data is the new currency. Data is, the fuel on which markets are running right now. How do we make sure that governments have the best data for health so that they can make the right decisions?
Excellent. Thank you so much, Marianne. And we'll actually stay with you and Jay, as you were two important co-authors of a recent publication focused on market shaping, where you explored some of the historical examples, best practices, learnings, perhaps even some unintended consequences of market shaping strategies that have been implemented. So in order to ground everyone in that same kind of foundational understanding of what has happened in the past, I would love for you to provide 2 minutes on key highlights, takeaways, things that you found really interesting about this discovery, things you would advise us to bring with us as we paint this future market shaping approach, things that we might forego and leave in the past. Anything you'd like to share, Marianne, and then Jay, I'll come to you if there's anything else.
And all in 2 minutes. So I'll put the link of the paper in the chat. But as I was rereading it, and we started this work in 2023, which seems like a century ago, honestly. But I reread it with the eye of, what's endured versus what's been upended. As you mentioned, we try to bring forth 4 cases of market shaping, really focused on therapeutics and vaccines, HIV, TB, hepatitis C, malaria, Ebola, which is obviously very relevant now. Through different types of mechanisms to improve market dynamics. In this audience, I don't need to belabor the point around, how these mechanisms were created to align supply and demand, to ensure uptake, to reduce uncertainty, whether that's by bringing more data and research, into the equation, or insurance mechanisms, reducing transaction cost, shifting and sharing risk. And I want to come back to the point Rafi made around how in the AI space, we need to create more incentives for risk taking, because that is what, kind of the paper at its heart was about, how to reduce or shift or share risk. That also speaks to one of the limitations of the paper, because it did focus on pharmaceuticals. We didn't talk about devices, we didn't talk about diagnostics, we didn't talk about tech-enabled or AI-enabled solutions. And I think that's where the world, is, right now. But what jumped out at me was none of the market-shaping examples would have been possible without flexible, mission-driven financing and sweat equity. And so I think that's something that is still needed. That's something that whose supply is more uncertain right now. But that ability of flexible, mission-driven financing, was key. The second thing, that jumped out of me, it reminded me of kind of the original impetus, for the big global financing institutions, Gavi and Global Fund, originally kind of set out, to better align the markets through pooled procurement mechanisms, advanced purchase agreements, et cetera. And I do think reminding ourselves of that fact, especially at a time where there are so many conversations about global health architecture and global health refinancing reform, is important. But the third point I want to make, and we actually changed the title of this talk from market shaping to market building, is I think the disruption that has come to the kind of donor-driven global health ecosystem is also coming for the commercial driven, kind of global health ecosystem. Those, kind of old paradigms, old norms that we all operated under, they're being blown up. The solutions are changing. There are new market players, new types of entrants into the market, new rules, a new pace. And I think for me, one of the most important trends for us to think about is the direct to consumer, trend, and how when consumers don't have good information, full information, markets are not going to work. And, in the earlier conversation, we talked about the risk of disparities and inequities. And I think, that's a critical one. But just to end, I thought about what are the first principles, that this paper is reminding us of. And for me, it was about how do we build the foundations for markets to work? It's not about tinkering at the edges and building scaffolding, because if those original structures fall down, the scaffolding collapses as well. So how do we build those foundations that allow a diversity, of mechanisms to proliferate? And again, thinking that at least in this moment of time, it seems that a lot of the solutions are in the digital, kind of AI space. one of the things we did as an organization, and that's Vital Strategies, is we wanted to kind of reorient the conversation in the foundations. And so somebody mentioned WHA. We released a new report, and I'll do a little plug for it here. Foundations and Futures, Reimagining Public Health in the AI Era, where we spoke to the need to invest in the critical national foundational infrastructure that would allow the right types of public health impact, in this new AI era. And then my last point, Rafi talked about the three legs of the stool, commercial, government, and civil society. One of the things we found out also at WHA is there's not only information asymmetry at the consumer level, also at the government level. And so how do we create mechanisms for governments to learn from each other as they are negotiating with commercial entrants, into this new market? And there's a lot of appetite, for that. So each government does not have to reinvent the wheel as they are building, their own national institutions and policies and practices to better shape markets. I know that was over 2 minutes, so thank you.
That's okay. I'll let you have that. Thank you, Marianne. So what I'm hearing, just to summarize, is flexible mission-driven financing, new actors at the table, including consumers, the role of pooled procurement organizations like Agavi, like a global fund. What does it mean if those don't exist? How do we effectively share risk? And what is the role of bringing some of these additional innovations beyond pharmaceutical products, beyond vaccines, beyond diagnostics to the table as we think about our market shaping approach? Because oftentimes innovators who are producing tech innovations are left out of these market shaping conversations, and those are equally important to consider. Jay, is there anything you wanted to add before we move forward?
Maybe a couple of things there. I think, the idea of market shaping initially was really centered on, reducing the prices. It's more like considered as price slashing or just getting a better deal for a longest time. And it sort of inspired this paper because we wanted to lay out as a group, and it came out of a panel discussion that we had at one of the CUGH meetings. We want to lay out as a group, what are the different types of market shaping mechanisms? How do they work? What have they worked on? And where are the major gaps as we're shaping towards the future market shaping areas itself? So I think, and happy to go into examples of what's emerging coming out of the existing market shaping areas in a bit. But I think just from our data, we've definitely highlighted areas where access is extremely fragmented. We've got certain therapeutic areas where we have very, very few producers making vital products. For example, not enough innovative products are actually designed with communities in low and middle income countries in mind, or even co-designed, right? And that's changing to some degree, but it's just not yet at the level where enough communities have the right medicines even designed for them, let alone available. And we all make the assumption that all the medicines and products are assumed to be available just because they're generic, but they're actually not available in countries for communities itself. So, and a lot of market shaping activities has been centered on a few disease areas that I think has done tremendous things in progress. But there's a whole lot of products and systems that actually need shaping. And patients and communities need a whole host of other things beyond medicines, as Marianne also mentioned there. In our data, we've also shown that patients' assistance programs has really been driving some of the NCD activities. When you think of just the collective nature of the diabetes care, the company's active in type 1 diabetes. When you look at the programmatic interventions for children, only 1% of children are actually being reached by these very, very solid, good programs, but only 1% of children, with type 1 diabetes are even being reached by this, and many of them age out of the assistance program, which are primarily donations. And then they're left to figure out where to get the medicines in a general marketplace. So, and you've got many of these examples across a number of NCDs. So I think the main idea that we wanted to get across is the next generation market shaping initiatives has to focus has to move from dropping the unit cost of a drug only to some sort of a multidimensional framework that builds that local healthcare workforce data and regulatory infrastructure alongside each other. A lot of that can be AI enabled in order to make sure that the aggregation of demand, aggregation of data, for example, in building registries, can actually be done in a more efficient way. And ideally, you're looking at sustainable market structures that are going to be moving away from a top-down donor purchasing model towards interventions that actually co-design with communities and finance using different mechanisms. I'm happy to go into the different mechanisms that we're exploring right now.
Excellent. Thank you, Jay. And I think you really nicely segued us into the next discussion and shared some early thoughts. But I think what's really important for us to do before we dive into designing what the future looks like is to acknowledge what are some of the principles that historically governed market shaping that no longer stand today. So Jay, you mentioned that we should be leading with a North Star of reduction of price. Maybe that's no longer important. Marianne, you mentioned new actors need to be at the table. This isn't just a government manufacturer community kind of angle. We need to think about what other stakeholders from a non-traditional standpoint need to be involved. So Yasmin, I'd like to go to you to share any additional perspectives on what assumptions about market shaping are you leaving in the past?
Thank you. And I think it's not necessarily different from what's been said before. I mean, I really think emphasizing Rafi's point about the ecosystem is something that we have seen that's really important from our work. And I think this covers what Jay and we were just talking about, Marianne were just talking about. We, from our work, I'll just give an example of, and it's an example of some work we've been doing with Ministry of Health and private sector with family planning and trying to expand. I think there's the government's goal was to build a total market approach for family planning, unburden the public sector a little bit and acknowledge that Kenya, as it becomes more middle income, has women who are seeking discretion, convenience, access through other channels. And, before this, you essentially had the free public sector and you had the high-end private sector where, $100 to see a specialist provider. And there's, what we call that middle private sector that is really important to reach and meet many women where they are. But that sector wasn't serving women when it comes to family planning. And so I think some of the work we've done has been to try and understand how do you help government and that private sector expand quality, expand access, build a reputation where for decades women don't. In Kenya, the pharmacy is the first stop shop for pretty much every Kenyan when it comes to for anything, even for me, right? Except when it comes to reproductive health, family planning. And that's because there's been such a heavy, free, subsidized source of product through public sector. And so there's not a lot of trust in that, in community pharmacies, retail pharmacies, and even the smaller private clinics, which are more affordable for this growing middle class. They don't trust that these providers can meet their reproductive health needs. And so one of the challenges we've been working with, along with so many other stakeholders, is how do you build that trust? And how do you incentivize a pharmacist who, is a business person? Now, how do you help them expand their definition of what the pharmacy sector is capable of if they want it? And of course, there's many segments within, we have 7,500 registered pharmacies. Not all of them want to actually provide services, but some do. And so I think that ecosystem, acknowledging the importance of the ecosystem and how it needs to evolve and what, the new players that need to be in the ecosystem is really important. But another thing I think we found is that the operational aspect of that ecosystem doesn't work right now. Distributors and wholesalers they're not equipped, to, for example, if you look at family planning products, when we talk about the incentives, even beyond the financial incentives, they're not getting signals on this from the pharmacies and the clients. So they're not stocking. So even as you try and expand some of the access points, there are supply chain challenges in there. So I think there's a really important aspect of building operations, acknowledging that there needs to be new players, and there are new players, but even the existing players will need to evolve to serve the needs of some of these clients a little bit better. And we do look at it, while it may be a product focus sometimes, it is trying to understand and working with pharmacies to say, these are women who may come in, for family planning, but they're the primary shoppers in their household for health. They're probably going to come in and buy other things. So look at them as your customers and try and build them, try and understand what their global needs are, not just a one product need. So I think those are some of the trends we see. And then also trying to work with government. The big gap, I think my colleagues have already talked about it, is the lack of the asynchronous data, right? Governments don't have enough data. Pharmacies don't understand what their suppliers have in stock. Like, there's just not enough data to understand how do you really help shape and build this ecosystem in a way that does serve women or whoever you're trying to serve better. And so I think there's a lot of work to be done, and it is being done. But those are, just to add to what has been said, those are some of the practical aspects that we see.
Excellent. Thank you so much. So getting medicine, diagnostic, vaccine to the tarmac isn't enough. What is the ecosystem of players beyond that need to be activated in order for the market shaping solution to actually be successful? And how do we start thinking about whole patient care, market shaping for integrated systems instead of vertical silos? Joanna, I'd like to come to you with the same question. What are some of the principles that you've historically used or thought of from a market shaping perspective that are changing or evolving today that might stay in the past?
Yeah, thanks so much. And I agree with everything that has been said by my fellow panelists. I think one thing I will say is I will actually take diagnostics off of the tarmac where you just put it, because as somebody who has been very involved in market shaping and specifically has worked on many of the deals that brought down the prices of HIV medicines when I worked for the Clinton Health Access Initiative, I think that these efforts have been incredible. I think the paper that my fellow panelists wrote did a really great job of laying it out. And I think those efforts are critical and need to continue. But they're one piece of the puzzle. And I think that's what everybody now recognizes. It's not the full picture. And I think as we go forward, we really need to move beyond thinking about market shaping around lowering the cost of a medicine or vaccine, which has already been said, to, I think it's more about health system shaping and an outcomes-based approach. So specifically, I mean, some of the issues that we were seeing, and this is before the last 18 months. So I want to be clear that like these things were going on before the disruptions are, it's amazing now that people have access to HIV medicines, but they're also dying of preventable illnesses like cervical cancer, different things, and we are unable to deliver the services to them that could prevent those things because of the way the siloed infrastructure is set up. So we really need to start moving towards a patient-based approach, bringing in different services. And I think that's a place where there's many things that come into play here, but because my expertise is in diagnostics, this has been a key challenge because many, I would say, of the market shaping techniques that were incredibly effective for medicines and vaccines, frankly, don't work well for diagnostics unless if you're talking about a rapid antigen test, yes, I think that can work. But when we start talking about more complex diagnostics, when we work in high income countries, something we talk a lot about is that we're 50% service and 50% product. And the market shaping approaches that have been used treat us as 100% product. And so what that's going to mean is you're getting some really bad service and you're not getting the diagnostics delivery you need. And so I do think starting to really think about like, how do we approach patients, healthcare systems, ecosystems. And I would imagine also many of the tools that we're talking about here around technology and AI would also maybe have some of the similar challenges that we've had in diagnostics, that you are going to need certain on the ground capacity. So I think starting to think more holistically about how we take forward the things that have worked, but recognize that like there's a new challenge now that we have to tackle.
Excellent. Thank you so much. So we've acknowledged some of the challenges and some of what's changing. I want to move us to the exciting part of the dialogue. What's emerging? What are some of the really interesting new models for market shaping that we can point to replicate, to scale, to further interrogate? And I think that one of the things that we're seeing is that a lot of these innovations, these interesting models, are coming from places where traditional boundaries are blurred. So between the public and the private sector, between global and local, between health and non-health actors. And it's where these kind of tensions, or what Rafi said, points of friction, where some of this innovation is coming. So I want to go first to Yasmin, who will provide the country perspective. Where are you seeing exciting emerging models coming from your work on the ground? And what can we learn from those examples?
So I think one example, I'm a big, for anyone who has talked to me, I'm a big believer in the power of data as a way of driving change in the system. And, you know, whether data alone will not solve it. Everyone needs to use the data, but I think you need to start from a premise of having enough data, the right data, and having the right people have access to the right data. One of the things we, in partnership with the Ministry of Health and the Gates Foundation, have been trying to understand is how do you, from a very respectful local perspective, create a whole market sort of data picture. For example, you know, we have two sides to the work we do. So we work in the public sector with the ministry to strengthen family planning supply chains, and have used AI-enabled tools for forecasting supply planning. We have a really good picture of that data because someone invested in that information system, and that data is relatively strong, good quality, available, visible, and used. Because not only was the data system invested in, people have invested in the process, and people know how to use and digest that data. In our work with the with the pharmacy sector and private clinics, there's no data that is available to that ecosystem. And so one of the things we've been trying to understand is what would incentivize pharmacies to actually report some of their data. How do you build a data system for the private sector when they worry about things like the tax authority? They may not want to share all that data with everyone. You know, how do you respect data protection? And what is the minimum amount of data that will keep the Ministry of Health satisfied that they're getting enough and will not disrupt pharmacy workflows? And so I think that might be a really interesting, we're actually right in the middle of it now. So I can't necessarily say that I haven't seen an example where this has easily been solved, but I do think things like that might be the next frontier for us, because as we talk about these blurred lines and trying to understand how do you make space in this ecosystem for the necessarily relevant expanded group of players, we need to understand the roles and the impact that everyone is bringing to the table. And you can't really do that without data. And so to some extent, you do need this full view of data from the ecosystem. And I think it's exciting to try and build that in a way that is a co-creative process with all the partners. So I would say that's a space to look at, because I think if you do get the right data and the right people have access to it, and they're at the table together talking about how to use it, that could really help shape this in a very interesting way. Just as an example, one of the things that beyond trying to track what is the profile of women that are coming into these pharmacies? Are they new clients? Are they revisit clients? Because that allows you to then understand. Is it because women want to be initiated in a clinic, get their refill in a pharmacy? There's all sorts of things that you can understand from that. But the other piece we're seeing, and I think this speaks to the financial piece, is the price points. And, without understanding price sensitivity, you can't really help meet the different segments of women with the private sector, because we're coming from a place where the private sector existed for the very wealthy. And now what we're trying to do is make space for middle-class women who have different affordability characteristics. And we don't know what those are. And so I think it is really important to have data in a way that allows government and the private sector to respond to some of those needs.
Excellent, thank you. And Joanna, you have a slightly different perspective, of course, coming from a different sector, and you have evolved your market shaping approach pretty significantly from the start to where it is now. And I'm curious if you can share that story with us, how it kind of evolved, but also what were the critical success factors that were required in order to enable that evolution?
Yeah, it's very nice to call them critical success factors versus not working. So, I mean, I think for us, this has definitely been a journey as an organization. I mean, a couple of the things that I would highlight is our focus on scalability. I think that what we have learned over the years is like, you can come in with resources and make anything happen on a small scale. But the question is that actually scalable for broad impact? And we learned the hard way many times that as the private sector coming in and putting a lot of resources behind a pilot project did not result in any sort of scalability. And as a result, we don't do that anymore. Now, how we really try to focus is, if we're going to work on a pilot, is to, from the beginning, have the right partners at the table in a coalition. So thinking about the Ministry of Health, thinking about, key implementing partners, thinking about civil society, and also having some roadmap for where the funding will come from for scalability. Now, that still oftentimes has not worked. I'm going to be honest, because the biggest issue is always the funding. And I think one of the challenges we've had specifically, again, before the last 18 months, was just the second you stepped out of the HIV, TB, malaria zones, it was really challenging on the resourcing front. So I still think, though, the approach that we've taken stands, that we need to be working in coalitions, thinking about scalability from the start, and really considering like what the funding models will be to get us there. I do believe that some of the challenges do bring opportunity, in that the breakdown of the silos will enable the creation of stronger integrated primary care that then opens the door to being able to bring more things into the healthcare system at an overall lower cost. But it's definitely, I mean, I think as a large company, many people come to us sort of for money. And we at this point are pretty transparent that we just don't work that way because it's not effective.
Thank you. And before we move on to really actionable, concrete recommendations from the panelists, Jay, I wanted to ask you some emerging models, things that you find really exciting in this space, because I know you're working across a really broad set of different actors and stakeholders. You assess and evaluate the success of access strategies and approaches. What are you really excited about?
Ooh, tough one. I can tell you what I'm seeing. I mean, it's hard to get me excited about things, because I've seen so much data over the last 20 years. But I'll try to have some enthusiasm in this thing. I think there has been a few key trends. Now I'm making everyone laugh and joke. A few key trends, right? There's a large number of funds that have been evolving. That there's been many organizations setting up funds to help co-finance. There is, I think, a number of trends in coordinating and collating data, and I'm most excited about how that influences procurement. And I think, as Joanna mentioned, there's a lot more consortia and coalitions being formed. Often, a lot of these things are working in a kind of like a vertical setting, for HIV, for diabetes care, for women's and children's healthcare in that sense. And I think we can have a lot of efficiencies in if we were to have a platform where some of these models can be shared. I'll give you a couple of things that we've seen just in a minute. So one is, I think the organizations that have been working on pooled and coordinated procurement, they're looking to see whether they can add additional areas and looking at different financing models, but perhaps many people in the room already know that. And I think what's interesting is there's a model now which is run by an organization called AxMed. It's ex-pharma people who have come together. What they've done is they've created a sort of a platform for coordinating procurement across different agencies that buy. But interestingly, a lot of the demand data can be collated, and the demand data is extremely valuable in basically being able to create that predictability that manufacturers actually need. And my hope is that this is not only available for a select number of diseases driven by only a few donor priorities, but it's really available for really the needs that communities are struggling with in terms of the highest burden of diseases. And my hope is that this will also expand into ensuring that procurement is also from local manufacturers in the African continent, for example, especially for products where the procurement supplies can actually be available in a cost-effective way in the continent itself. But there have also been very, very small interventions that I'm quite excited about. We've been struggling for a long time in just saying nothing's being done with the Pacific Islands. Not much attention is there in the Pacific Islands. And there has been some interventions now looking at not trying to do a pool of procurement because there are many different country systems to align on a single procurement contract. So that's a nightmare. But instead, they've come up with another solution, which is a central warehousing location and fixing purchasing to be annual. So countries are more aware of like, what do I need for this year? And even that has made a huge difference in terms of uptake and availability and access. And there are other models outside of medicines. When you're thinking about energy, factories are now looking at solarization so that they can keep the energy costs low so that they can be more cost effective in producing products. We work in medical oxygen where really making sure that biomedical engineers and service contracts are added on top of the commodity itself means, tells the difference between a broken machine 5 years down the line versus a machine that actually works and is sustainable over time. So having a framework for what those type of contractual agreements could look like when you're thinking of a commodity like oxygen and oxygen systems, I think are some of the areas. But I can keep talking about this for hours, but I'll stop with these few examples to say there are a few things that are coming out that are exciting.
Thank you so much. And yes, I think we could all talk about this for hours. I am seeing the time signal in the back. So I'm going to ask each of you to close with a really concrete recommendation and or opportunity statement that others can take through in their work. So if you were advising the people in this room, NGOs, multilaterals, innovators, industry, what can they start doing tomorrow to think differently about their market shaping approach? Or what do you wish they would know based on your experience to help expedite how they get to that future good more quickly? Marianne, I'll start with you.
Sure. So and many of you who know me know I always say this, let's get out of our bubbles. So for health, we need to sit at non-health sector tables. There's so much happening outside of health, and I'm excited about the kind of regulatory change happening that's going to build markets, and particularly for the African continent, I think better shape and increase the size of that market. And then the second thing, if you'll allow me, is all of this is possible. I was just in Rwanda. Yasmin, you talked about not knowing enough data for kind of demand forecasting. We're there. But what we need to do is come together as a sector to actually call for the right types of investments in the right things at the right time and be very deliberate and intentional about how we build these markets that are going to support all of our work.
Thank you, Marianne. Joanna, over to you.
Yeah, I mean, I personally believe that the only path forward is together. I think that at the country level, there's tremendous collaboration between the private and public sector. I think this forum has always been one that has provided that, but I don't think that's true of most of the rest of the global health space. And in fact, I think that the dialogue and the relationships are kind of at some of the worst points they've been in quite a while. And so I just really believe that we have to work together. We have to understand each other's perspectives, and we have to act in good faith to solve these very real problems.
Thank you, Joanna. Yasmin.
Not too different from what has been said, but I think trying to bring in a different angle. I do think really addressing these pain points of fragmentation, asynchronous investments, data, all the rest is really important. But I think for us, it's a challenge for us as a community that is used to working very differently, where we make investments and we put in time and work and we want to see impact fairly quickly. If we're trying to build these ecosystems and build these markets of the future, are we willing to slow down a bit and make sure that really the government we're not just giving lip service to the government being a partner, or civil society, or all these new players that are new. And so, we have to make space for people to join this ecosystem and participate meaningfully. And that takes time, and which means some of our results may take time too. So my question is, are we willing to slow down a little bit and do the hard work of building these ecosystems that really will deliver more affordable access, equitable access to the communities that we're trying to serve?
Thank you. And Jay, I'll leave you with the final word.
Yeah, that's the hardest bit. So I think there are ways that we can unlock financing and capitals. I've written an entire op-ed on that in terms of how many countries can actually look up and set up health taxes via tobacco and sugar taxes, promoting local production to reduce reliance on imports and really build up supply chains, and using a portion of diaspora capital and annual remittances to be channeled towards predictable financing, and also trying to keep money that's being lost when people go out of the African continent to get care abroad, keeping that back in town. But I think there's also a lot of examples out there of things that are working, but they're working in one situation, and it's not easy to transfer that to another situation. But it's also not easy for people to know what is happening in those situations. Like an annual payment model that decouples developers' revenue from the physical volume of drugs sold, which is kind of critical for any low volume restricted product like antibiotics in that sense, right? So I think we need a platform where practices are being shared, not just in terms of I did this, but being shared in a sense where you can also ask questions, say, okay, if I want to bring this into my universe of my land, my product, my ecosystem, and shape the market in a slightly different way, what would that entail? And having access to the right people to do that, I think is one of the critical ways to unlock these examples to become scalable.
Excellent. Thank you so much. So we have a challenge ahead, right? The challenge is not just to simply shape markets for products and access and low cost, but to build people-centered integrated systems and markets that endure. So I'd like to challenge all of you to take that into, our lunch and networking hour, speak to people in other sectors, as Joanna said, understand their business models, how they operate, why they work the way that they work, share best practices, as Jay said. Are you seeing things working? How could they be scaled, replicated in other areas? And really dive in and help us shape that next generation of market shaping approaches. So huge thank you to the panelists for joining. I would love to open it up to Q&A before we go. So if you have a question in the room, please raise your hand and we'll bring the mic around. And if you have a question online, please do put that in the chat and we'll facilitate it from there.
James Berrigan, thanks for a great panel. You guys just so dynamic and topics that are close to my heart. And I just really briefly want to acknowledge, Joanna, your comment about scalability. And it's not just an important criteria, but it also gives you a different lens through which you develop project and you understand stakeholders. So I just want to validate that. And then Yasmin, your focus on emerging middle class is way too often overlooked, I think, in business models generally, and is somewhat problematic as something that we neglect. But I think really the theme that's most dominant and perplexing is this idea of flexible mission-driven financing. And in a way, mission-driven and flexible are contradictory because we've got mission-driven people out there, mission-driven organizations out there who want to fund, and they become quite vertical in their focus, and we don't achieve the flexible. And as glass half full as I am as a human being, I get a little pessimistic sometimes at the lack of momentum in that direction. And that flexible mission-driven is all the more important in the context of infrastructure. And each one of you have been speaking to infrastructure, because infrastructure is complex and it's not an easy story to tell to a funder. And so there's like these inherent contradictions that I live and breathe every day, and I know all of you do too. And I'm just interested if you can kind of speak to that innate challenge we're all facing.
Thank you so much, James. Marianne, do you want to take that?
Yes.
Given you raised the term.
I do, and fully agree with everything you said. When I said mission, I did mean, kind of the broader global health equity mission, not necessarily disease specific or vertical programs or projects. I think we need to come together with, a very clear call to action and ask of funders where we're asking for the same things. That really drove our Foundations and Futures report. At the end, there's a call to action. I would love, and I'm just making this up as I'm talking right now, Lisa, Abby and Sarah, can Bay Area Global Health Alliance, be part of building momentum where we are making specific asks, of all of the different types of donors to invest in infrastructure, to invest in the foundations, to invest in building markets that are going to serve all of us. I would love for that to be an outcome, of this meeting. I think it's very hard for funders to say no when multiple types of stakeholders are coming to them together with the same ask. But, I may be proven wrong, but, let's try it.
Thank you, Marianne.
Yes, thank you very much for the interesting conversation, the panel. My name is Payam Nahid. I'm the Executive Director for UCSF Institute for Global Health Sciences. And one question I had for the panel was what opportunities there are to move access conditions and the dialogue around them upstream into the R&D space, which is where I live, and get research institutions to engage in that. Because I heard a lot of downstream activities and financing, and I think a lot of work can be done upstream from the design of our trials and protocols and the information we gather. Of course, it needs funding, and usually these are the activities that are often unfunded. But I wondered what the panel thought about upstream levers for improving access conditions in the R&D space.
Thank you so much. Joanna, do you want to take that?
Sure. Sorry, there's so much swimming around in my head around this topic. This is what I would say, broad strokes from the company perspective. Our experience has been generally when we have moved forward with funding R&D specifically focused on these markets, oftentimes there isn't really a return on the other side. And that's very challenging because the way that companies, there's like all these things, and there's like committees and groups that make decisions about which projects go forward. And candidly, the return on investment is a big part of that equation. So I do think that moving forward with better health system infrastructure, so there are better pathways for things to come in, would be a real game changer. Because I think one of the things over the last decade has been, if it's not an HIV, TB, or malaria product, where's the funding? And I think what's fundamentally different in my experience between these markets and, European markets, many markets in Asia and the US, is that, we think from a standpoint of unmet medical need. And if we identify an unmet medical need and we develop a product that meets that medical need, it will be adopted. But that is oftentimes not true, frankly, because the funding isn't there in many of these markets. So you just sort of end up hitting a wall and then oftentimes being asked, well, can you just, give it away for free? And it's a challenge. The other thing I'm going to say, because I feel like every 2 years I'm interviewed by someone about what we can do to like spark it. We don't need a TPP. That is not the problem. It's not that we don't understand the needs.
You define TPP for
Yes,
folks who
a
don't know.
target product profile. I don't need a target product profile, and I don't need a epidemiology-based forecast of the unmet need. Those are not going to help us. It's all about the health system market dynamics that will adopt the product.
Thank you. Go ahead, Abby.
I'm going to share one from online from May from DNDI, which is related. So maybe to continue to build on this, market shaping seems to always be based on incentives from the current profit-driven system. Is anyone working on or aware of emerging ways to better incentivize companies, pharmacies, and governments to value higher health equity and not leave any part of the population behind?
Would you like to keep going on that, or should we?
Well, I would just say, I think that's a global problem. I think that's an everywhere problem. And I think more and more, something I've noticed is that the issues that I'm dealing with and talking about when I'm in Europe and the US are becoming less and less different than the issues that are being talked about related to low and middle income countries. So I think that there is a fundamental tension between a profit-based health system and providing public health. I don't think that should be localized to LMICs. I think we need to, as societies, be having that conversation, and if it's ultimately delivering the outcomes we want for our society. That's me speaking.
Jay, I'm curious from your work as well. Have you uncovered any emerging functions, bodies, alliances, mechanisms, or means that help align incentives in this way?
Yeah, a number of things, and it touches on the previous question also. So we've been doing a bit of a round between all the different funding organizations of some of the largest R&D projects in the world, right? So NIH, Cancer Research UK, Gates Wellcome, those that are already invested in low-income countries and those who are not yet invested in low-income country innovations. And you could see, there's, again, not a platform where they can understand how can you do this? What are the terms and conditions that you can actually put on the table far upstream or already as an investor investing in a company that is practical enough to not dissuade innovation in some way, right? And we've built a number of frameworks that Wellcome Trust now uses. NIH, we did some consultations where they talked to us a little bit about, what can we do at the university level that doesn't downstream disincentivize the commercialization of a particular product. We've worked with CEPI on their platform. What can they put in contractually, what not in that sense. So there are different ways that you can incentivize, better R&D where it ends up reaching the patients. And surprisingly, in the last 20 years, we've measured how pharmaceutical companies are doing kind of earlier access planning for R&D products. And actually, it's been going really uphill. Like mostly, initially, there was no companies that really had any early access plans that was paired into with their innovative developments, with no guarantees that these products will actually be made in low-income countries. And over the years, most of the pharmaceutical companies we measure now have a plan, but the plan is not at scale in multiple countries, right? It's in a few LMICs, but at least most of the companies actually have a plan for something in place. When you're thinking about, really changing the incentive system, a number of pharmaceutical companies, a number of mid-sized companies also are looking at cost production and availability of products, or second or dual brand systems. So some of those are really testing their limits of the profit margins they're willing to make, but it obviously hasn't gone enough to really address the affordability gaps in the world yet.
Yep, go ahead.
I do want to clarify one thing related to that question, because I don't want my comments to be misunderstood. I think from our perspective, what we are looking for is to be able to fund the R&D and then be able to provide the product in the way and at the cost that it costs us to manufacture and provide the service. A nonprofit has the same constraints as that, right? So I think there is also a big gap between, it's one thing to be talking about trying to make very, very large profits, but it's another thing to just be talking about, is the basic return on investment there, that if you invest the resources to develop it, and then there will be reasonable pricing, people to buy it, to make it sustainable. And we're still not seeing that in a lot of places. So I do want to just clarify that that's kind of the bar I'm speaking about.
Thank you so much. Any other questions in the room or online?
Hi, Scott Rosenblum with Global Impact Advisors. And I was just curious how the panel thought about the relationship between the efforts, especially since COVID, to build local and regional manufacturing capacity amidst market shaping that often puts kind of a focus on lower costs, but also sustainable markets, wholesale distribution, and the like. And where are their tensions and where's their complementarity? Thanks.
Thank you so much for that question. Yasmin, would you like to discuss this a little bit, the local manufacturing?
Yeah, thank you for the question. And it's a great question. I think some of these conversations from the local level, local government and industry level, are really nascent. So I think some of them are still starting, and I think you sort of put your finger on or pointed to some of the challenges, or perhaps someone did earlier. So I think, understanding the size of the market is a really important gap, that is existing right now. And then also, and this is why I think I was speaking to the need for data earlier. So I think there's a lot of, in a place like Kenya, and I'm sure Jay knows a lot more about this, but there's a lot of vibrant discussions around and people entering the marketplace to understand where are the opportunities. And I think one of the big challenges is it's hard to pinpoint those opportunities from size of market perspective, especially in one country. And if you look across East Africa as a community, for example, there is potentially, the size of the market that would validate sort of going into this space. But our regulatory barriers across countries are so high and the data, trying to sort of aggregate that data, that is where some of the challenges are. And then I think the other parts of the conversation I've been hearing are, how do we decide what to manufacture first or at the same time? How do we prioritize some of those? So for example, do we look at, and I think this speaks to May's question, do we look at those products that there's no incentive off continent to manufacture those products that speak to some of the NTDs, the neglected tropical diseases and other things that we might have. Like how do we, and these are some of the conversations that I think are happening, how do we decide what is a priority? Do we want to find a balance between those life-saving commodities that we need to make sure we have a sustainable market for, and regardless of what happens, COVID or fuel crisis in the Middle East, we're still going to be able to assure that we can assure a supply of those products locally, for example. But, is cancer, the cancer oncology market something we need to look at? And so I think there's all these conversations happening that are trying to understand what the size of the market is, what potential profitability, because even locally, that is something that is obviously being considered. And then also thinking through the risk around, and there's also capacity. Kenya has a couple of really good examples of, and not product, but syringe manufacturing. And now I'm looking at, I think the latest one last week was a device one. And so there are some good stories, but I think what we miss in those stories is what is the impact going to be of some of those very great success stories of local manufacturing, but are they really speaking to the problems that we have? I'm not sure I fully answered your question, but I don't think we've evolved enough in this space to be able to answer it fully. One of my panelists might have more to add though.
Thank you.
Go ahead,
Yasmin.
Marianne.
Yeah, and something you said prompted this. I think, one point to make, and I think this relates, Joanna, to, some of what you were sharing, is that the same issues that, Roche or Merck or Sanofi has in terms of making the business case work, for manufacturing certain products where, the market is, let's just say East Africa. Those problems exist for the local manufacturer as well, and so I don't think we should, we should not think of local manufacturing as solving the problem without dealing with all of the other contextual market shaping barrier removals that need to happen. But then the other thing I want to put on the table, because I don't think we've said it explicitly, whether you're in a high-income country, middle-income country, or I guess theoretically in a lower-income country, government has been, and I think will continue to be, the biggest purchaser of health. They're not necessarily the biggest deliverer of health. I think in high-income countries, we see multiple different types of delivery systems and delivery mechanisms for health. But at the end of the day, through insurance, et cetera, they're mostly the biggest purchaser of health. In many low-income countries, that is not yet the case, or at least not the case for a broad array of health needs. And so, again, I just come back to this point around, unless we strengthen, kind of government ability, whether it's through universal healthcare coverage or some other type of insurance, or, kind of subsidizing folks getting care from, private sector, we will not solve, the ultimate market failure, which is making sure that there is the ability, for consumers, for end users, for patients, to have access, to the products and to the solutions.
That's a really important point. Thank you. And I see one final question over
one
here.
question. It's sort of broad, but I think we can maybe help sort of tie things up. And the first and foremost, the four of you are really inspiring communicators in a really, really important area, and we really, really need that. I'll come back to you. So I'm Fred Senko. I'm a local physician. I helped my brother Paul start UGHE 8 years ago in Rwanda, and I've been very engaged in that, and so recently gotten into health. The elephant in the room is that the public partnership right now in this country is just diminishing. It's disappearing. And the concern that I have working also at Stanford is there's a retrenchment also at the academic level. And to come back to what Rafi was saying, we need to tee up creativity and risk-taking, and that the large institutions, both Stanford, Harvard, Johns Hopkins, they're retrenching on that. At the same time, and Joanna, this reflects to you, we have a population around, an extraordinary population around the world where NCDs are growing in their significance, and there are real markets. And yet the strategics, I feel I bumped my head against the wall many times trying to get therapeutics, diagnostics into these places, and the strategics not understanding the medium and the long-term view of that. So my question to the four of you, as incredible communicators, as incredible stories, how can we do a better job? And maybe this is the Bear Global Health Alliance is going to do this or something, but how do we become better communicators of this really significant situation?
Thank you so much. Marianne, I might come back to you because you've been doing a lot of thinking on this issue, particularly in the NCD space. And then I'll ask others if you want to build.
I think this comes back to the health equity question. I think for too long, and I use the metaphorical we have excluded huge swaths of the population of this world from dignity, kind of human value and right to health. And I think until we bring all of those people into who we think deserve health and should be part of our market, and we build, with that underlying assumption, we're all just kind of, not being honest with ourselves.
Joanna, go ahead.
I agree with Marianne, and I also have actually a slightly different perspective, given that my role is to figure out how to communicate with governments in terms of what they care about today to get them to spend more money on health. And now is not the easiest moment to do that. And I do think we need to broaden the message, and I think we need to be connecting more the realities of population health to economics, GDP growth, global health security. When you have countries that are left behind, when you have countries where people have no hope, that is not good for many of the issues that our governments do care about today. So I also think one of the challenges that we have as a global health community is we really like to sit together and talk to each other. And how do we figure out how to bring in other stakeholders? Something we talk about a lot is how can we better engage ministers of finance, not just ministers of health? How do we sort of broaden this to think about the broader implications for societies, their health and their growth if we don't make the right investments in healthcare? And I absolutely agree with you. I mean, NCDs is front and center with this TB, malaria, HIV issue of like, we have this huge NCD piece coming up and we need to be investing in it and thinking about it.
Excellent. So I think with that, we will close today's discussion. A huge thank you for your engagement, participation, to the panelists for your really insightful comments. Maybe next year we can give an update on the future of market shaping. So thank you.